Hello students, welcome again to this lecture of health economics. I'll be your lecturer, Madam Mbone Mwalenga, from the School of Public Health. Today, our lesson will be lesson number 11 and we'll be tackling economics of illnesses. Welcome. So before we begin our lesson for today, I want us to do a recap of the lesson that we did last week. Remember last week we tackled the issue of health and economic development. So I would like to take you to go through a few key points that we discussed last time so that we can now connect to this lesson of this week. So health and economic development. We said that there's an association between health and economic development. The association, we said, is a two-way phenomena, with health being both influenced and influencing economic development. So health influences economic development, and at the same time it's influenced by economic development. Another key point we said is that economic development is not only linked to improvement of economic indicators alone or improvement of basic needs. It is also linked to wider aspirations such as a high health status. When you talk of economic indicators, for example, we are meaning income per capita, either at individual level or at national level. Basic needs, as you know, they include things like food, shelter, education. So when you are looking at economic development, then we are looking at issues more than economic indicators, more than basic needs, and we include issues of high health status. When it comes to investments, we said that investments should be in basic needs. For example, in health service sector. When you invest in basic needs in the health service sector, for example, human capital, for example, capital for buildings and hospitals, then the investments in this human capital, of course, in turn promotes economic development. Lastly, we say as health planners and as health managers, it is our responsibility to be concerned about economic development. How do you get concerned? By being knowledgeable on what development implies and the role of health, the role that health plays in economic development in any given country. So when you're graduating, then you should be in the know-how of how you as a health worker plays a role and how health plays a role in development of a country. So now we can move to the lesson of this week, economics of illnesses. So let's look at our objectives for today. Now at the end of this lesson, we are saying as learners, we should be able to, one, define the concept of economics of illnesses. After defining the concept, we would want to link this concept to the current global health situation. After that, we should be able to demonstrate an understanding of the importance of economics of illnesses. Then we should be able to discuss the impact of illnesses both at microeconomic level and macroeconomic levels. And finally, we should be able to discuss the economic impact of pandemics. So those are our learning objectives of today's lesson. Now let's define the concept. And by doing this, I want us to revise some of the terms we had used in the previous lessons. For example, economics. We had said economics is basically a social science that deals or is concerned with factors that determine three things. One, production, 2, distribution, and 3, consumption of both goods and services. That is the basic definition of economics. When you bring in health, then we defined in health economics, we say health in economics is termed as a good and service. That means it can be traded in a given market. When in the market we have absence of health, then that leaves us with illness. Illness being the absence of health in the market, which means that illness is a period of sickness, or you can say a disease, which affects either the body or the mind or both of them. Once you have the illness either being at individual level or community level, then you have the illness spreading rapidly in a large number of people in any given community within a short period of time. Then that becomes an epidemic. An illness spreading rapidly within a given population within a short period of time gives birth to an epidemic. Now, when this epidemic spreads across a large region, for example, across continents or worldwide, then the name changes and it becomes a pandemic. A pandemic is an epidemic that cuts across a large region like worldwide. And a very good example of an epidemic, a pandemic you're having now is the coronavirus disease, also known as COVID-19. So we are saying economics of illnesses sometimes is referred to as an economic burden of disease. And this can be termed as the impact of illness, of the disease as measured in economic value or in economic terms. When you're measuring anything in economic terms, most people think of monetary value in terms of money. But here we are saying we are measuring economic value, which includes both the monetary value and the opportunity costs. As you remember in our previous lessons, opportunity cost is the next foregone cost of the next foregone opportunity. Now, economic impact can then be analyzed and measured at 2 levels. One, the microeconomic level, which includes individuals, that is you and I. Then we have communities, and then we have households. We are also not forgetting the farms or the industries and factories that we work in. It can also be measured and analyzed at a national level, like Kenya, or at worldwide, which includes more nations than one country. As we continue with the definition of terms, let's look at the importance. So why exactly are we learning about economics of illnesses? We realize that health is core. Health is core in any thriving, productive society. Once we have the absence of health, which will now bring about illness and of course fear, then this is going to affect the components of a thriving and productive society. We are saying illness can stifle production, it can stifle consumption, it will definitely stifle recreation, traveling will also be affected, and of course the general well-being of the people in that community. Then we are looking at the economic burden resulting from that illness. The economic burden resulting from either the illness, the disability, and of course premature death. Why are we studying the economic burden? It's because it is very important when it comes to allocation of health care resources. That is one. It is also important when you are looking at evaluation of health programs and research in health programs. Economic costs of illness continue to play a very vital role in decision making regarding the allocation of resources in the health sector. So we are saying that the economic burden of illnesses is important in 1, allocation of healthcare resources, 2, decision making of the same allocation of resources, and 3, evaluation of the health programs and research. What this means is it represents the monetary burden of a society. It definitely affects the monetary value of what we do and how we handle our resources, either at community level, at individual level, at family or household level, and even nationwide. So to understand how ill health and its economic consequences, one has to first understand how health contributes to one's social welfare. So how does health contribute to one's utility or social welfare? We are saying 1, people value health. That means people prefer at any one given moment to be more healthy than to be less healthy. If you are given a choice to be healthy or to be sick, definitely you will choose to be healthy. So the value of health is quite important in people's lives. Secondly, we are saying for one to be able to enjoy the consumption of other goods and services, that depends on one's level of health. For example, when you are very sick and you are bedridden, sometimes you cannot even able to enjoy the basic need of food, which means as much as you want to consume another product, your health status does not allow you. Thirdly, we are saying without good health, other economic objectives or functions, for example, activities that help you produce income or activities that help you consume your income, are compromised. Once you're sick, maybe you want to go to work, you are not able because you are bedridden. That compromises your ability to produce income. So those are the 3 levels at levels at individual capacity that affect economic of illnesses at that level. We are looking at the second level, which is the household, or commonly known as family. You find that in low-income countries, a high proportion of their monetary resources end up being used in ill health. For example, you find out of pocket. When somebody is sick, they tend to use a lot of the cash at hand to handle any illnesses that occur. Even for those who have insurance, before you go and visit a doctor so that you can use your insurance savings, you find that most people would want either to go to a chemist to buy a painkiller or any other consumption medicine, which now entails them spending a lot of cash at hand on ill health. And once you start spending cash at hand on ill health goods, then that will compromise spending on the non-health goods and services. Another issue at household level is the time spent seeking health care, or time that prevents now one to go to work. Either you are bedridden or you you are taking care of somebody else who is sick. This definitely will reduce your production function and definitely to reduce your consumption of both market and non-market goods. Another issue at household level is the impact that is just not limited to the current time. You find a number of illnesses go beyond the present time. So you find once you spend cash at hand at a particular illness, once that cash at hand is finished, then you are forced to dig into your savings, if there are any savings that you have. If you don't have any savings available, then the other option would be to take a loan. Take a loan, and if maybe you have assets, then you are forced to sell those assets. All that eat into your future savings. Another impact on household is the impact or reduction of household income, household savings, or household assets. If two people are earning income in a house or in a family, and then one of them falls sick and they are compromised, they cannot go to work, that means the level of income will go down, which will affect the level of savings, the level of assets, and definitely things to do with investments and consumption of possibilities in future. Now, looking at the other level of microeconomic level, we are looking at the farms. These are the places of work, the factories, the offices where we work, and we are finding that ill health at the farm level reduces productivity and efficiency of a farm. Once the productivity level is reduced, then it negatively affects the earnings and the profits of that farm, which in turn will affect negatively the investments of profits and the accumulation of wealth, and of course consumption possibility of its owners. So one thing leads negatively to another. Even though the productive capacity of a farm can be determined by other factors apart from human capital, which means that if you do not go to work today, maybe your farm will get somebody else to do that work. Because apart from human capital, we have things like technology that can be used to compensate human absence from work, which is very okay. But you find that what are the implications of such an action? That you'll have higher costs. The farm will spend a higher cost to keep this excess capacity. Excess capacity means that that's somebody else who has to come up and do your job when you are absent from work. We also have farms will now definitely plan to devote a number of a high proportion of their operating activities to health-related expenditures. That means maybe they would want to help or chip in the expenses of one of their staff members, or they would want to also help in insurance, so that when the staff member is there, all functions still continue. Now, what about at the microeconomic level? We said the microeconomics, we are dealing with national level. Now we are saying disease or injury impacts macroeconomic performance or outputs in the following ways. One, we have increased health expenditures at national level. We have reduced labor and productivity. And then we have reduced investments in human and physical capital. Now, as we know, the government, which is at national level, deals with public goods. And we say health is a public good because it affects almost everybody. It affects everybody within a nation. So it is the function of the government to be concerned about the health of its people. Now, once the government is dealing with the public good, it then is concerned about the reduction of its output and the increase of cost of producing this public good. Now, the government is more concerned with ill health of the population on its financial expenditures and receipts. So it will do as much as it can to reduce the increased cost of providing financial health services so that we have increased social security payments which come in forms of tax. And it will do as much as possible to alleviate disability and unemployment benefits. That is at a macroeconomic level. Now, let us look at GDP. We are saying that the impact of disease over society normally is expressed in terms of gross domestic product, commonly known as GDP. GDP is simply an aggregate of three things. 1, household consumption. 2, investment by firms in non-financial products. And 3, of course, government expenditure. Those three components make up GDP. But you find that GDP is not a complete measure of the economic welfare. Why? Because GDP does not include a number of key issues, like 1, non-market consumption, the value of leisure, which is not measured by the GDP, and even the value of health itself. Now, let us look at pandemics, like the one we are having now, coronavirus. So what are the economic implications of such a pandemic to the individual, community, and nation? You find that most pandemics, which come from epidemics, are caused by infectious diseases. For example, influenza, which spreads directly or indirectly. Coronavirus spreads basically by contact with an infected person. So the most crucial aspect of a pandemic is human suffering or the loss of lives, which comes in great numbers. Like, for example, right now, coronavirus, we are talking about deaths to a tune of more than 15,000 worldwide, which is a great loss of human life. This comes with other significant losses. For example, we have reduction in the size of labor force. We have reduction in productivity. We have increased absenteeism from work. All those people who are sick or infected contribute to the reduction of either labor force and productivity, and of course absenteeism to work. We also have individual or social measures that are disrupting economic activities. These measures also affect productivity at your work. Because you don't want to get infected by the virus, you choose to stay at home for safety. We are not forgetting the cost of elevated mortality. Now, how does this cost come about? For example, we are looking at the severe global 1918 influenza pandemic. This accounted for about $500 billion US dollars, which was 0.6% of the global income. Now, last year in 2019, a joint report by the World Health Organization and the World Bank estimated the impacts of pandemics. And they reported that a current pandemic in this century will bring a total cost of $3 trillion US dollars, which will affect at least 4.8% of any global gross domestic product. That is a lot of economic loss. Now, apart from that, we have additional implications of pandemics, like substantial loss of growth in the private sector. We have right now in coronavirus, we have in the private sector, people being forced to take unpaid leave. When you take unpaid leave, then that affects your survival. We have post-threats of food security. In the agricultural industry, a lot of industries like the ones in Naivasha have been forced to let go their workers so that they do not encourage the spread of the virus. We also have a burden in cross-border trade. You cannot cross over to other countries like Uganda or Tanzania because of those restrictions. They do not also want to help spread the virus across the borders, which affects trade in the country and definitely the economic impacts. Looking at the national level, how does the pandemic affect us? We have particular sectors in the economy that are actually more hard hit than others. For example, the obvious sector of health. Pandemic being a health issue, it directly affects health, both in the public and private system. Right now we have an upsurge of hospital admissions, resulting in sudden peaks of both administrative and operational expenditure. The other day the CS was talking about how they need money so that they can employ more doctors to take care of the consequences of the pandemic. This directly affects administrative and operational costs. The need for more goods like the masks and the gloves and the drugs, this directly affects the operational expenditure, which was not anticipated in the first place. Another immediate observable effect of the pandemic is the need for authorities in a country to take action. For example, in closing down the learning institution at both primary and tertiary levels so that they can reduce the spread of the pandemic. Another sector, of course, is the cost of reduction of transportation, whereby people are now required to sit at an interval of 1.5 meters, and many public transport offers are not able to put up with that standard. We also have the government being proactive, or people being proactive and taking their own precautionary measures. For example, you have a lot of people staying at home and restraining from going to work for their own benefit of not getting the virus. Or some are staying home so that they can be able to take care of a sick family member who is not able to take care of themselves. All that impacts negatively on our economic value. Now, we have an example here of the H1N1 pandemic in the year 2009. This research was looking at the missed days, the number of days people miss at work in Chile. And it was found that these mean days missed significantly resulted in a minimum of $16 million that led to loss of labor productivity. We also have other utilities like shops and companies that suspend their workforce for a particular time, and this definitely affects production in various sectors, affecting the total economic expenditure. A good example is the MERS virus that cost the local tourism sector a whopping $2.6 million. So we are looking at very significant economic impact losses of a pandemic. Now, in conclusion, what do we say? That one, pandemics are here with us, even in the 21st century, despite our technology and advancement, and they bring about these significant economic losses at both microeconomic and macroeconomic levels of the economy. Secondly, as a nation, it is not possible to prevent the occurrence of pandemics, but we can invest in measures to mitigate and cushion economic impact associated with these occurrences. So thank you very much, and let's meet in the next lesson.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.